So welcome to this open day session, giving you some information about the postgraduate courses in preventive medicine and cardiovascular health. My name's Jenny Jones and I'm course director for some of the programs within this suite. And I'm also joined today by Maureen Boyle, who is our course coordinator and is very much involved in the timetabling and day-to-day delivery and answering questions and inquiries and so on. So between us today, we're going to give an overview of the course and also answer any of your questions. So in terms of these postgraduate programs, there's a number of them that fit under this portfolio or suite of courses under the overarching umbrella of preventive medicine and cardiovascular health. So currently there are 5 courses on offer in total in the postgraduate suite, and this session will specifically look at those that sit in the School of Medicine as opposed to some of the offerings are in the School of Nursing. So these programs include the MSc in Preventive Cardiology, the MSc in Cardiovascular and Pulmonary Rehabilitation, the MSc in Obesity, the MSc in Diabetes, and the Postgraduate Certificate in Cardiac Rehabilitation. And you can find out more using the link to nipcc.ie postgrad. So a little bit of background as to, well, what is NIPC? So the NIPC is the National Institute for Prevention and Cardiovascular Health. It's housed in a heart and stroke centre, the Cree Heart and Stroke Centre, which is based a stone throws away from the university campus. So for many years, there's been a strong alliance between NUI Galway and Cree Heart and Stroke Charity, and now it's national reach through this NIPC. So here you have pictured Professor Gerard Flaherty and you have Mr. Neil Johnson, who are from the representative organisations, and they're the ones who set up the first MSc course that's in this portfolio, which is the MSc in Preventive Cardiology. So with a team of healthcare professionals and academics coming together, this Masters in Preventive Cardiology began in 2013. And it really looks at multidisciplinary approaches to cardiovascular health and lifestyle medicine. So that course is very well established and has, I think of it as the sort of sistership or the mothership, and these other courses use various components. So there's a large component of sharing some modules that are relevant across courses that look into non-communicable disease and prevention and control of these conditions. So the NIPC, as I've said, the National Institute for Prevention and Cardiovascular Health, was established in 2014. It's affiliated directly to NUI Galway with a strategic partnership, and it does bring a really unique opportunity for students to engage in the application of learning. So within this facility are a range of about 30 different programs that tackle all sorts of aspects of cardiovascular health and non-communicable disease management. So it does provide a very unique opportunity for research dissertations for students, but also for first-hand experience working with a multidisciplinary team, applying learning into practice. So in 2019, the MSc in Diabetes commenced at NUI Galway, and in 2020, the MSc in Obesity commenced at NUI Galway. And you can see both the course directors for these respective programs listed here. And it very much fits with preventive cardiology as well, because preventive cardiology is looking across the spectrum of conditions in terms of atherosclerotic disease, but also those conditions that have significant risk that leads to cardiovascular disease. So we've begun this portfolio of courses that brings together experts and specialist subject areas, but then also looks at the commonalities and the specialisms of lifestyle approaches to non-communicable disease prevention and management, pharmacological approaches, and so on. So that's how the courses, a little bit of history as to where we're at with these courses. And why have we pulled them together? Well, I've alluded to this already, and you can see here from the World Health Organization that 4 risk factors essentially are strongly linked to these major non-communicable diseases. And these diseases cause 80% of all mortality. So at least 3 out of 4 deaths are due to non-communicable disease. And yet 80% of that is preventable. And that's where these courses come in under this remit of preventive medicine. It's recognizing these enormous overlaps between cardiovascular disease, diabetes, cancer, and chronic respiratory diseases. So we have courses that encompass all of these important aspects, recognizing the significant overlaps and recognizing the enormous potential in prevention and recovery. So the courses the master's courses all run from a September start. So if you're joining this recording of the session, you're looking at start of September 2022, if you're looking to one of the master's streams. If you're looking at the postgraduate certificate in cardiac rehabilitation, this actually starts each January of each year. So applications close imminently, actually, the sort of end of the first week of December, but you still would have time if you are interested specifically in that program. So it's either a September start if you're looking for a master's, or it's a January start if you're looking for a postgraduate certificate, which you could then extend into the master's subsequently. So these are the modules. So just a very whistle-stop tour. The Masters in Preventive Cardiology has a number of set modules. So there are modules where they're compulsory. All the first term are highlighted here in kind of the light blue. So you do 3 modules: fundamentals of preventive cardiology research methods, reflective clinical practice, each of them worth 10 credits. In the second semester, you have to choose between the advanced optional modules that needs to add up to 30 credits. And the research project is continuing throughout the duration of the year. So it actually spans across the 3 semesters. So that, in a nutshell, is the preventive cardiology and its sort of modular structure and the choices available. For diabetes, in term 1, you do very diabetes-specific modules. So they are run by the diabetes team specifically. So you're looking at Professor Derek O'Keefe and Dr. Eva Flynn are coordinating a number of diabetes-specific modules and research methods-related exposures, which altogether are 30 credits. And then in semester 2, which starts in January, you join these choices that are on offer, where you do another 30 credits worth. And through the duration of the 3 semesters, you have your research dissertation. So you can see where the shared modules are, but also you can see that you are exposed to clearly, diabetes, very diabetes-specific expertise throughout. And no surprise, the MSc in Obesity has a similar structure, where in semester 1, you're looking very specifically at obesity-specific modules and research methods, and you choose your modules in semester 2 with your project running throughout, which will obviously be obesity-focused. And then the MSc in Cardiovascular and Pulmonary Rehabilitation, again, you'll see a pattern here, but in semester 1, you're doing specific modules related to the context of integrated care and specifically to cardiovascular rehabilitation, cardiac rehabilitation, and pulmonary rehabilitation, then you choose your optional modules, and your dissertation is obviously, again, in the specialism area. So hopefully that's given a little bit of an overview. In terms of the teaching team, we're very fortunate because of the connections that we have with NUIG and the National Institute for Prevention and Cardiovascular Health, and also the connections that NIPC has internationally, as well as NUIG internationally. There are experts from all areas of cardiology, of epidemiology, of endocrinology, of respiratory health, of obesity. So we're very fortunate to have a truly interdisciplinary team of experts coming from physicians from these areas, senior researchers, global experts, as well as, clinicians from interdisciplinary backgrounds in nursing, dietetics, physiotherapy, psychology, health promotion. So it is a very all-rounded teaching experience, which reflects the nature of our course, which is interdisciplinary students coming from an array of backgrounds. So how does the timetable work? Well, the timetable, if I talk specifically about the MSc in Preventive Cardiology, the PG Cert in Cardiac Rehab, and the MSc in Cardiovascular and Pulmonary Rehabilitation. So these three courses are all directed by myself and very much with the leadership and coordination of Maureen as well. And our course teaching, these courses, they are all taught on a Friday and a Saturday. So they are all taught on a Friday afternoon, late afternoon into the evening, and on a Saturday, usually from about 10 till 5. It's not every Friday, it's not every Saturday, but essentially you won't have teaching on other days of the week. And we do provide your teaching dates. As you join the course, you know your whole year of teaching dates ahead of time. So again, you're able to block those out and plan accordingly. And the course is described, these courses are described as in service. Now, what that means is that they're designed for clinicians or for allied professions and other health-related professional backgrounds that are interested in working in clinical settings or with clinical populations or people with, long-term conditions or in communities actually preventing long-term conditions. The point being that when we say in service, it would typically be, a nurse, a dietitian, physio, medical doctor, who would be continuing with their work practice and then attending the course teaching sessions on a Friday, late afternoon, evening, and Saturdays as timetabled, as well as completing distance studies set for, the period ahead, meaning that you can juggle the learning, your course, in amongst continuing your professional career. So many of the assignments align to the implementation piece. So as a clinician working in practice, you will be taking your learning and applying it. And part of your assignments relate to actually taking that experience and reflecting on that and writing up, the implementation piece. So that's what we mean by in service. Now, we do have many students who are potentially not working in clinical practice, maybe because they've chosen to come and study full-time in Galway and they've left their job temporarily to do so. Now, because of the nature of the course, where there is this implementation piece, if that's the case, we set you up with placement experiences and internship experiences in the Cree Heart and Stroke Centre. So there's a clinical component to the course, in a nutshell, or these courses, but that clinical component for many of you actually is your working environment. And that makes it very feasible to complete your studies whilst simultaneously continuing work and managing other priorities. So with that in mind, we have moved all the teaching to remote delivery. And that's not due to COVID, actually. It's about making sure that the course is accessible wherever you are, either in the country or internationally. And there may be some time differences that you'll have to take into account. But those sessions are all delivered and they're scheduled in real time, but they're delivered using remote approaches. And then any face-to-face is very much for those that warrant that face-to-face internship, clinical exposure, because perhaps they're not working clinically. You would be required to come to Galway for that particular element. So how does a timetable work? So here is an example. Here you can see one of the Saturdays listed, and you'll see that at 10 o'clock in the morning, it's research methods, who the tutor is and which of the courses that session is applicable to. And in this particular example, on this particular Saturday, the MSc in cardiovascular and pulmonary rehabilitation were required to stay on additionally. So when we say Fridays and Saturdays, it depends which course you're doing as to which Fridays and which Saturdays, and then how much of a Friday or how much of a Saturday. And then you're given homework. So it's not just a matter of attending, you do have to plan to cover your studies in preparation. And those workbooks are very carefully planned and have received very positive feedback. So we work on a system called Blackboard, which is essentially a virtual learning environment. We set each module up to create a repository of all the sessions, the recordings of the sessions, the workbooks, also interactive communications, debate topics, your ability to ask questions, to tutors, and submit your assignments. So very much Blackboard is at the heart of each of the modules in terms of the day-to-day running, which again makes it flexible, remote, available. You can be out for a walk and listening to one of the podcasts or one of your learning tasks simultaneously. So I mentioned that the course is delivered in very strong partnership with the National Institute for Prevention and Cardiovascular Health. And I would urge you that if you are interested in any of these courses, or you're interested in the subject of cardiovascular health and cardiovascular disease prevention, and the wider risk factors associated, such as diabetes and obesity, then please do consider joining the NIPCC Alliance. You can see the link there. This is a free initiative to join. It is an area where once you join that area, you're able to access all sorts of recordings from all sorts of amazing series and webinars from the past, and also going forward. You would be alerted a range of additional educational activities. Even if you don't choose to study these courses, but you have an interest in these areas, it's definitely worth you joining so that you are alerted to some of these additional free opportunities that regularly come up. And you'll also be able to register for these NIPC events, as well as access the recordings of these events. So just this week, on Friday this week and on Saturday this week, Friday afternoon to be specific and Saturday morning, we have an amazing conference. It's our annual conference, it's our 8th one, and we have a world-class lineup, a formidable program. It's free to register, so do consider registering for this event accordingly. And thank you for listening. I hope that was a useful summary of the courses that we offer in preventive medicine and cardiovascular health. Thank you.